is to work with our clients to improve patient care, work with our clients to enhance the patient experience, and work with our clients to maintain a financially healthy business. Our mission is to improve the healthcare experience by delivering the highest value health and IT business solutions to our clients. Bottom line is, we are here to help and serve you in any way that we can. A look at our solutions and services model. I'm not going to go into each area, but I will show or tell you that we divided into 3 areas: practice management, information technology, and patient care. And the solution that we're talking about today falls underneath the productivity, products, and enhancement area of practice management. Back to today's webinar on ensuring that your physicians and providers can continue to see their patients when they lose access to NextGen. At the end of the presentation, we'll answer all of your questions, and you may type them in the questions area of the webinar control panel whenever they occur to you. And as I mentioned earlier, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. So if you do experience audio issues, please use the chat box to let us know so we can resolve them. As a matter of introduction, my name's Tom Seco. As I mentioned, I'm the business development manager with the organization, and with me is Joe Scholes. Joe is our director of product solutions. He and his team developed all of the products that all the NextGen add-on products that we sell. This is just the agenda that we're going to go through today. You'll gain an understanding of why organizations invest in this type of solution. We'll talk about EHR dependencies. We'll show the output that's generated by ChartGuard, and as I mentioned, we'll answer any questions that you have at the end of the webinar. So, about today is how to be prepared for unplanned downtime. There was a study done back in 2021, or a survey done back in 2021, and this is some of the results of that survey. As you see, it says 69% of the data center owners and operators reported experiencing some form of outage, regardless of severity, in the past 3 years. And they kind of categorize them as either being fleeting or substantial. So just over respondents said half the downtime incidents are fleeting and have few consequences, and the remaining half cause substantial financial, operational, and reputational damage. Most common causes of the outages that were reported: software or IT system errors, network issues, on-site power system issues, and cooling failures. With regards to classifying the outage as being significant, serious, or severe, 62% of the outages cost more than $100,000, and 15% of the outages cost over $1 million. And then 79% of the data center outages involved human error. So 2 types of issues contributing to these types of incidences: staff failing to execute properly, and using incorrect processes and procedures that are to be executed. So it's kind of interesting, the results that came out of that survey. EHR systems are based on complex technology, between our own systems and possibly third-party hosted systems. We have servers, we have workstations, we have scanners, we have tablets, we got internet connections, we got T1 lines, fiber lines, VPNs, wireless routers, local area networks, we got power systems, we got cooling systems. And behind each one of these pieces of hardware is also software. And so any one of those components, either hardware or software within the hardware, fails, you can lose connectivity and have an issue. So those are some components that contribute to the complex technology that we have. And if we lose access to our EHR systems, it means that our quality of care can be impacted. We can lose productivity. We can lose revenue. And, when we're in front of a patient and we all of a sudden lose access to something, it doesn't go well and doesn't sit well with everybody taking a look at it. a look at the types of causes that cause downtime situations. I have over the years gone in and did some research on outages and what causes them. And this is kind of a sampling of what I found in my research. I'm not going to go into each one of these, but you do see here, I've listed out, when the outage occurred, who caused it, or who had the outage, what was the cause of the outage, what was the effect of that outage, and how long was the duration of the outage, and maybe the type of it, if I could determine that from what caused that. You can see that there's hardware type causes of failure, construction, damaging a fiber optic line. There's software errors where have to do with authentications. There's human errors in the case of the second one from the bottom. Somebody crashed their car into a pole and caused the internet to get lost to thousands of people and organizations as well. So there's a lot of different reasons for it, a lot of things that are out of our control, obviously, that happen, and it does, span a lot of different ways that can happen. Like I said, construction, hardware outages, software outages, human error, and the durations can be anywhere from, an hour to multiple hours, and as you see there as well. So just a reminder of how things can happen and why these unplanned outages occur. There was a study done as far as what an outage can cost, downtime can cost an organization, a healthcare organization. And this study determined that it could cost as much as $488 per hour per provider. So it can be quite expensive. So a 10 provider practice, if you extrapolate that out, is down for 4 hours. It can cost as much as $19,520. So it can be quite expensive when downtime does occur to the organization and affects productivity, affects revenue, and all of these factors were taken into that cost. And because we have situations that can affect our EHR systems, HIPAA has a clause in it that says we should have some type of contingency plan or plans for responding to various emergencies or other types of situations that can impact our EHR systems. So what are some of the options that are available to us when we're dealing with an outage? Well, we can temporarily close the practice or close the location that's being affected by the downtime situation. We can implement fully redundant technologies to help us reduce the outage or the effect or the possibility of an outage, I should say. And that would be maybe adding more network connections or adding more power systems or more cooling systems. But when you start doing that, it becomes very expensive to do that as well. We can go back to paper charts, but that's becoming more and more difficult for us to do because we become so dependent on our technology and our EHR systems. Another option is to implement a solution that ensures that you are prepared to handle a downtime situation. So that's the type of solution that we're talking about today. As we reflect on just what I talked about, that our systems are complex, that our systems are dependent on many components, that downtime is caused by unexpected events which can be beyond our control. And as also we reflect on the options that are available to us when a downtime situation occurs, these are some of the questions that we should be asking ourselves and thinking about. So starting at the top right corner of the screen and then moving clockwise, do I pursue uptime or do I pursue a solution that enables me to continue on with my business until NextGen comes back online? So do I implement a bunch of redundant technologies to pursue, trying to get to nirvana, 100% uptime all the time, which there's always some type of risk to any component that we have in our systems of having a failure? Or do I pursue a solution that enables me to continue on with my business until NextGen comes online? So is there some solution that I can put in place that allows me to operate without having to do a massive investment in hardware and other technology? What are the impacts of downtime that a downtime incident can have on our clinics? I mentioned the impact to loss of productivity, impact to revenue, impact to patient satisfaction. So identify what those impacts are when you lose downtime, and how those impacts could happen to your clinics. And then how significant can that impact be to our clinic based on the duration of the downtime incident? So if I was down for an hour, what would that hour downtime impact on productivity? What would that being down for an hour impact our revenue? What would that impact be to our patient satisfaction? So just kind of go through that exercise on the types of impacts that you have, and then for the duration. So if you're down for an hour, what would that impact be? If you're down for 2 hours, what would that impact be on productivity, on patient satisfaction, on revenue? And then if I was down for 3 hours, what would that impact be on productivity? What would it be on impact on revenue? What would it be on patient satisfaction? So just kind of go through that exercise as well. And then if I'm going, am I going to be reactive or proactive? My clinic's preparedness for downtime, meaning I've had a downtime situation before, and I'm now reacting to that experience because I'm looking for a solution to put in place so I don't experience that downtime situation. Or I haven't had a downtime situation, but I want to be proactive because I know it may happen to us, so I want to be ready for it. So, what's my thinking in my preparedness for being down? And then when was the last time we reviewed our downtime preparedness and business continuity strategy and plan? Everybody usually has some type of a downtime preparedness and business continuity strategy, and when they first write it, everything's great, but then they don't look at it for another year or 2 years or 3 years. It's just kind of sitting there. But our business has evolved over that period of time. So we should be going back to review our downtime preparedness and business continuity strategy and plans on an annual basis at least, because our business continues to evolve over time. And how do I minimize the loss, and how do I minimize the disruption when a downtime situation does happen? So how do I minimize the loss? How do I minimize the loss of productivity? How do I minimize the loss of revenue? How do I minimize the loss, reduction in patient satisfaction, when a downtime situation occurs? And how would I minimize the disruption to our workflow process and our patient flow process? How do I minimize that disruption to our clinic when we do encounter a downtime situation? And then when we experience an unexpected downtime situation, who would be the first to notice there's no access to NextGen? Would that be the front office? Would it be the back office? Would it be the physicians when they're in the middle of seeing one of their patients? So think about that as well, as far as who would be the first one to experience, what's the notification process within the organization when that does occur, and then what's our process to put in place once we experience it, once we're in the midst of a downtime situation, how can we go about our business and minimize the disruption and minimize the impact to the organization. So again, just some questions to think about as you're going through and thinking about downtime and thinking about a possible solution. So we did just that. Our clients, we had a couple of clients that did that years ago, and they came to us and asked us to see if we could develop a solution for them. They had their ideas on what they would like to have as far as solution. Their main thing was make sure that it's cost effective and make sure that it's easy to use and easy to implement. So we set out to do that, and we developed ChartGuard for our NextGen clients. And it is a cost-effective, easy to use business continuity solution that ensures that you are prepared for a downtime situation at each of your office locations or clinic locations, and that you have access to your patient charts during an EHR downtime situation. Over to Joe, and Joe's going to talk for a couple of minutes about how ChartGuard works.
All right, thank you, Tom, and thank you everyone for joining us today. Tom mentioned quite a bit in the slides coming up to this, but the end result is working with clients. What we found out is there are many of you out there who want a solution that doesn't have high monthly fees. It isn't out in the cloud where your data can be hacked or where it can be inaccessible if your network's down that you use to connect to NextGen. So we wanted the data to be local within each of your locations. That was the solution, is why not have a system that looks at your appointment chart for the next several days out, generates PDF files of the patient charts, and then deposits them on a designated computer at each of your locations. So when there is an outage, whether it's maintenance going long, whether it's a storm coming through and taking down network lines, whether it's some virus in your data center, you have those charts for the people who are scheduled to come in on site and available to you. So in the middle of this diagram, we see your EHR, right? Your NextGen sitting in the middle of the world, and that's kind of where all your eggs are. They're in that one basket right now. So the goal is, let's start taking eggs out of the basket and pushing them out to the remote sites so you have other eggs out there so you can go ahead and access that clinical information. So each night, the ChartGuard engine is going to wake up, it's going to run, it's going to look at the appointment schedule for the next several days. For those people scheduled to come in, it's going to look at all of their clinical data, and it's going to look at where they're scheduled for their appointment. It's going to take a subset of that clinical data that you need for your downtime, create a PDF file for each patient's clinical data, so it's not one giant PDF file, and it's going to move those out to the appropriate locations, again, based on the appointment. The good thing is these PDF files are tunable. So if a patient's been coming to you for 15 years, you're not going to get a 500-page PDF file that someone has to sift through. And we'll take you through that in just a couple moments. But the big takeaway here is this runs within your network. Whether your network is hosted or all controlled by yourself, it's not a cloud-based solution where now you have yet another party with your data out there that, again, you may not be able to get to if there's a network outage. And you have these easy-to-use PDF files that you push out to each of the locations, and they can either be used electronically if the network is up within the four walls of that location, but you just can't get to your NextGen, or they can be printed to paper and put in a manila folder just like we did 20 years ago and set on the counter as each patient comes in. Additionally, on top of getting the patient charts for the people who are coming in that day at that location, we're going to give you an appointment listing so you know who's coming in that day at that location, and that enables you to better plan and print the charts kind of on demand. So if you think you're going to be down most of the day, you don't have to print all the charts right away, because if the system comes up in an hour, now you have all that paper you need to shred. So it gives you ways to be able to manage all this, and you're managing it within your network. So we're going to go ahead and talk about what comes in the charts, what's out of the box, and this is what I was talking about earlier. You're going to get your daily appointment listing by your resources, and then the appointments coming in by time. You're going to get your PDF file for each patient with your module data, your histories in there, any selected EHR generated documents that are relevant, anything in ICS that's relevant. We'll sit down and tune this with you so you're getting the right amount of data that your providers need during the downtime without pulling too much data that's unneeded and just creating clutter. So I'm going to go ahead and turn it back to Tom, and he's going to take you through the rest of this and show you what the charts look like that ChartGuard creates.
Okay, thank you, Joe. And like Joe said, I'm going to show you the example of the chart that's generated. Let me pull that up here. This is what the patient chart looks like in PDF format. So you see, as Joe mentioned, it's the demographic information at the first page. So you have the name and address of the patient, responsible party, primary insurance, secondary insurance, that type of information. And then now you get down into the module information as well. So here you get the information on the allergies in a nice table format. You get active medications in a nice table format. So each of these are sections within the file that you can scroll from top to bottom. Here's the labs. But as Joe mentioned, we also bookmarked each of these sections within the PDF. So if you come over to the bookmark, you can easily navigate to the section that you want to see and take a look at. So if you want to go back and look at medications, you go there. If you wanted to go back down to immunizations, you could take a look at it there. As Joe mentioned, we also bring in documents and ICS images. So here's an example of what a document looks like as it's incorporated into the PDF file. And then this is an example of an ICS image that's brought in as well. The bookmarks makes it much easier for the individual to go to a particular section that they want to take a look at, or they can elect to scroll from top to bottom to take a look at the information. As Joe mentioned, it's PDF file, so it's very easy to read on any type of device, like he said, whether it's a tablet, a laptop, a handheld device, smartphone, whatever it is. As long as it's got a PDF reader, it's able to read it. And you can control the depth of the information as well. So you can control it by a particular range of time or dates or number of instances. So you can have that control of it as well. And as Joe mentioned, we also provide the appointment listing. And this is what an example of the appointment listing looks like. So you have the name of the patient, when the patient is coming in, who they're coming in to see, and what they're coming in for. So this would be generated for each location. So this can be used at the front desk, and they can continue to have the patients come through. They know what they're coming in for, who they're coming in to see. So the continuity of the business continues with these documents, so that you can continue on while everybody else is working to bring NextGen. Your IT staff's working to bring NextGen online. Okay, so let's see here. Let's go back here. Oops. This is just a quote from one of our clients that use NextGen. They were kind enough to send us an email and let us know how ChartGuard worked for them. This particular client was an orthopedic client in Tennessee, and they took, like I said, took a quick moment to write us an email about their experience using ChartGuard. They're a fairly large organization now with about 20 physical locations, and they've been using ChartGuard for several years. But when they purchased ChartGuard and implemented it, 6 months later, they experienced an outage at two of their largest clinic locations. And prior to implementing ChartGuard, they would typically close the clinic location that was affected by an outage and turned away their patients. And with ChartGuard being implemented now, in this particular instance, they were able to continue to see their patients with minimal disruption using the appointment listing and the PDF files that were generated by ChartGuard. And their physicians were quite pleased with the solution that was in place. So just a testimonial to somebody who used it and experienced an outage and was able to use the software to continue to see their patients while he was working to get get NextGen back online. So what are some next steps? And we can take your questions at this time as well. So the next steps is if you have an interest in having a more in-depth discussion about ChartGuard, the solution that we showed today and talked about today, and how it would fit within your organization, we can schedule a time to have more in-depth discussion about that. You see my information up here, and you see Joe's information up here. You can send us an email or give us a call. and we'll be happy to talk about ChartGuard and how it would fit within your organization and how it would work with your current processes that you have in place within your organization. And so with that, we'll answer any questions that you have. You can answer them or type them into the questions box. One question that has come up is, we have a connection to our radiology department of the hospital that we're associated with. Can we bring in those images?
That's a good one, and one we get somewhat infrequently, but we have an answer for that one. That's the good news. If the images are coming into NextGen document management, we can go ahead and pull those in as images into your PDF file, just when we were talking about the list of things that we can pull in. So in that case, we can do it. Otherwise, if the radiology is a totally separate system and not sharing data, then we can't get into that system to grab the data. But if it's something that's critical to you, we can go ahead and look at a customization to go ahead and grab that data.
Is there any concern of EPHI lingering in the system?
The good news is with ChartGuard, it's really designed so the PHI stays on your network and within your network. It's not going out to the cloud and back. Everything happens within the scope of your current NextGen environment. Additionally, the system cleans up after itself. So if we're looking out 5 days in the schedule, we're going to keep that rolling 5 days worth of data and nothing else. We're not going to continue to accumulate data, A, because of the PHI issues, and B, we don't want to fill up the hard drive on the computers where these are landing at each location.
Is there any logging done in the system of the patient history being generated?
ChartGuard does its own logging as it brings the charts up, but really your logging is your appointment schedule. So we're just generating the charts for the people who have appointments. And in the future, we'll be expanding that out to the EPHI log for standard ChartGuard 2. We already do that with our ChartGuard on Demand product.
And one last question looks like, we're hosted by a third party. Does that pose any issues at all?
We'll work with you and your third party to find a solution for your hosting. We have many clients already that are hosted, both by NextGen and by other third-party hosting companies, even ourselves. So we'll be involved in the conference calls that need to take place to get ChartGuard approved for your environment and also to get it installed.
Great. Well, we're a couple minutes past the top of the hour, so we'll go ahead and close out the webinar at this point. But we appreciate you joining us today to learn about business continuity and our ChartGuard solution that we have in place for NextGen based practices. So thank you very much for attending, and have yourself a great rest of the day.
Thank you, everyone. Have a good one.
Thank you.